Trinidad and Tobago, we continue with the program. Well, a lot of young ladies, and not just young ladies, but a lot of men as well would look forward to a segment like this. We're talking about World or International Acne Month. I did not know we had an International Acne Month. I'm very happy to hear that. Dr. Rachael Eckel of the Skin Health Institute, of course, she's no stranger to us here on CTV, and today she's here to speak to us about acne. We're also joined by cosmetic doctor, also of the Skin Health Institute, Dr. Nadia Manna, and we're here talking about myths and the various ways to treat acne. So let's debunk some of those myths, shall we? Welcome, ladies. Good morning.
Thank you for having us, Verna.
So I did not know we had International Acne Month. How important is something like this?
So I believe that acne is one of the most common conditions that we see and treat in Trinidad. It is something that we see in teenagers, we see it in adults, and it is something that patients struggle with lifelong. But it's important to recognize that there are many incredible treatments out there for us to get full resolution of the acne and really exceptional results.
Incredible treatments. A lot of people would think about home treatments as well. So we'd like to talk a little bit about some of that. But before we get into that, I'd like to talk a little bit to Dr. Nadia Manna. I understand that you yourself struggled with acne as a young person.
Yes, so from my teenage years going on to adulthood as well, I'm a doctor, I have acne. That not only impacts negatively with respect to patient care, but with respect to my self-confidence as well. So acne has so much psychosocial effects with respect to how patients, how the general public views persons with acne. Because acne is disease of the skin. No one wants to have disease on their skin. So treating patients with acne is not just a passion of ours, but we're changing lives as well. When we're clearing skin, we're improving self-confidence. Patients look better, so they feel better about themselves as well.
Dr. Eckel, what causes acne?
So acne is multifactorial. It's partly genetic, meaning that you are born with the gene for acne, but that doesn't mean that you're going to get acne, because we know from identical twin studies, for example, where you have two twins with the same DNA, that one twin might get acne and one might not. So it's not just down to the genes. Clearly something will turn on the genes. So there's a genetic component. There's also a large hormonal component, meaning that stressful times, menstruation, things like PCOS, polycystic ovarian syndrome, all of these hormonal changes can also affect the acne. But there is also a large lifestyle component, and this is something that we spend a lot of time talking to patients and educating them about.
Absolutely.
For example, diet has a massive effect to play on acne. We know that things like dairy and sugar and refined foods, which we have an abundance of in Trinidad, has a huge impact on acne. In fact, there's a study that we love from this really cool little island in Papua New Guinea called Kitava. It's kind of like Tobago. It's like 30,000 inhabitants. It's a small little island. And on Kitava, there isn't one case of acne on the entire island. So is it that these Kitavans have a super gene? It's not, because if you take a Kitavan and put them in a westernized society like Trinidad and feed them the garbage that we eat, they get acne because the diet triggers the genes. So it's something in their diet that is suppressing the acne and keeping it at bay. And what researchers have pointed out is it actually has to do with dairy, it has to do with sugar, and it has to do with refined foods. So basically they eat a lot of fish, they eat a lot of vegetables. They also have coconuts quite a bit, which gives us a good fat, omega-3. And if they're going to eat a carbohydrate, it's not a pizza or ice cream or white bread. It's a carbohydrate that comes from the earth. So like a root vegetable, ground provision, like your sweet potato, your yams, dashings.
Absolutely.
So basically, eat from the earth to your table. Like the Rastafarians say, you should eat idle food. It's literally that.
I love it. What about adults who they're still plagued? Because a lot of the times, you said it's hormonal as well. So many times you think teenagers are the ones to break out. But then we have a lot of adults who have acne, and they may say, but I eat healthy. What is causing my acne?
So hormonal factors does have a part to play, but likewise, it has to do with genetics. It's built into our DNA and lifestyle as well. So yes, diet is of utmost importance, but at the end of the day, it doesn't matter if patients have mild acne, moderate acne, or severe acne as well. Any kind of acne can cause scarring. Not only would it affect every single cellular function of your skin, but yes, it affects patients' confidence as well. So patients, when they first come into our clinic, they're looking downwards. They don't even want to speak with us or have any eye contact with us. And they're on their phones, they're so distracted as well. And then we start treating their skin. Their head turns upwards. They're making eye contact with us. They want to tell us all of their stories about their amazing results, their transformation, how good they feel as well, that they look better with respect to their skin.
What do you do?
So I think that there are different reasons why we get acne, like I mentioned, but acne is really a disease of oil. So when we are children, we all have beautiful, perfect, healthy skin. And that's because as a child, we don't make oil. So there's no acne as a child. We have this beautiful porcelain skin. And then around the age of puberty, when the hormones start to kick in and we get an elevation in our testosterone hormone, the testosterone hormone aggravates and activates the oil glands, also known as sebaceous glands. And when these glands become active, boom, that's when we start to see acne. So acne is a disease that begins in the teenage years, and there's some statistics that say as much as 100% of patients in the teenage years will have acne of some sort. But then when we reach the age of 18 and the hormones normalize, some patients will go back to normalcy, where they won't have acne as an adult, or some patients, the oil glands will continue to stay enlarged, and then you have adult acne, and then that will lead to scarring and other complications.
So what sort of treatment do you all have to deal with acne?
So a multifactorial approach is what we take in our clinic, prescription topicals and creams, but patients have so much of a role to play as well with respect to their lifestyle, dietary regimes and whatnot as well. So just that lovely combination cocktail that we use in our clinic, that's how we got such amazing results as well.
Yeah.
So
our
just
results
come
are so basically, remember that acne is a disease, and acne is something that, just like cancer, let's just say you notice some sort of sign or symptom on the body and it turns out to be cancer. You don't wait until the cancer is metastasized for years and let it go untreated. You treat from the first sign, the first symptom, to prevent the progression. It's the same thing with acne. When acne first starts, it starts off as a whitehead or a blackhead, almost like a little weed in your yard. So it's very easy to treat. You can just pluck it out, simple to treat with topical agents. But if you neglect the acne for 3, 4, 5, 10, 20 years, that weed is going to become a giant tree in the skin. It's going to grow these deep roots down into the dermis of the skin. It's going to cause scarring. It becomes a much different animal. And you have to throw a lot more at it then in order to remedy the problem. So I think that it's important to recognize that all of the complications that we see, like scarring and all of these psychological components that come along with acne, we can definitely prevent that if we treat from the site of the first comedome. So the first blackhead, the first whitehead, that's when you start treatments, not when you have, severe scarring. Remember that a scar is permanent. So you can never make a scar perfect. We can do things to get it close to that, but you have to prevent those permanent changes in the skin.
How long would treatment take on average?
So we usually tell patients that when you are treating acne, so in the treatment phase, we do 18 weeks. And the reason for that is because 18 weeks are 3 6-week cycles. One cell cycle, one turnover, is 6 weeks. But at any one point, only about 30% of cells are active. So in one 6-week cycle, we're really only capturing about 30% of cells.
Yes.
So you need 3 6-week cycles, 18 weeks to capture all cells and completely inactivate the disease. But that said, we see results in our clinic where we see full acne clearance with some of the most difficult, challenging types of acne cases in 4 to 6 weeks.
Absolutely.
And then you just finish off the treatment, which will help to correct the scarring and the associated discoloration, and then you go on to a maintenance program.
Okay, I understand that we have a couple pictures as well that we would like to put up on the screen so Dr. Eckel can refer to them. So I'm seeing this is a before and after photo.
Yeah, so these are some patients that have been treated at the Skin Health Institute, and what you notice is that acne has the same roots of oil and sebum being the problem, but Remember that acne doesn't just cause a pimple. Acne it affects all cells at all layers. And as a result, we see many different changes. We see scars in this image, for example. This is very, very deep scarring. This is 6 months of using prescription topicals to improve the scars. And look at this incredible result. We see discoloration. We see large pores, rough texture, dullness, sensitivity, dryness. So there's so many different effects that acne has on the skin. It can also have effects on the eyes. If you notice in a lot of these patients, you're seeing discoloration around the eyes because the oil glands also grow around the eyes, and then it causes patients to have itchy eyes, dry eyes, something called meibomian gland dysfunction. So it also affects the eyes.
Dr. Manna, so we have patients, we've seen pictures of patients who would have come in and they've literally gotten a transformation in a sense. How do they maintain this? So they have to continue eating properly, but do they have to constantly come in for treatment?
So after we've treated your skin, cleared away that area of acne, remember acne is still very genetic. So there is that genetic component where we almost let you go. We teach you how to maintain your results, just to upkeep things, to give you the best amount of benefits of not just keeping your acne at bay, but continuing to make your skin look smooth and soft and glowing and firm. And patients, with respect to proper diet, with respect to proper lifestyle, and using the right sunscreen every single day as well, can maintain their results.
Wonderful. Dr. Eckel, we saw some deep scarring in that last photo. How were you able, is it laser treatment? What sort of treatment was involved there?
So with regards to scarring, we take a multidisciplinary approach. So I love prescription topical agents, and the results that we are able to achieve with the cocktail of prescription topicals we use are extraordinary. That case that you saw was a very difficult acne scarring case with very, very deep scars and very discolored scars. And technically the medical literature says if you use a prescription cream, it'll take 6 months before you see even a hint of change in a scar. In 2 weeks' time, we're seeing dramatic changes with the topicals that we're using. And in 6 months' time, you saw almost an 80 to 90% resolution in his acne scarring. Imagine that another 6 months is going to look even better. So in that case, we did topicals, but we also use things, for example, we do dermal fillers. And a new dermal filler that is on the market, this is pretty cool. Remember that a scar is basically a depression in the skin. And so when you have a concavity and the light hits it, it basically forms a shadow. So when we look at the skin with the imperfections, we're seeing a lot of shadowing because of the depression. We can use dermal fillers, which are a sugar molecule that we inject into the skin to lift up that depression. And not only does it lift it up so the light doesn't cast a shadow, but it also changes the color underneath the tissue so that when light hits it, you do not see the blue color of the shadow. So it gives you a better light reflection. So there's really fun things that you can do with fillers. There's also lasers, of course, that we can do. But again, I tend to start with my topicals because that gives me most of my resolution, and laser is icing on the cake.
How long do the fillers last?
So dermal fillers can last 3 months, 6 months, 9 months, 2 years. There are also some permanent fillers that you can use in acne scarring. It just depends on what is your injector's preference. We use ones that last 2 years at our clinic, and they have a really beautiful result. Very soft, very natural, very subtle, and they just integrate beautifully into the tissue.
Now, you described it as a cocktail that you all would recommend. My question is, how long would that regime take? Like every morning you have to wake up. Is it very time consuming? What's the procedure like?
How long would you have taken prior to treating your skin? How long would you have taken to put on makeup every morning?
Probably about like 20 minutes. And now, I mean, of course, at first when you first start doing anything in life, it's different. So at first I would probably take about 10 minutes to do my morning regime. And now I take like 3 minutes. So at the end of the day, it's so much quicker than standing in front of your mirror, putting on makeup. Now I can go barefaced with respect to seeing my patients in clinic in my everyday practice. And I feel so much better as well, so much more confident. And it's quick, it's nice, it's easy, convenient to do.
So are people actually coming out and getting this treatment done, and what sort of results have you been getting?
So we've been getting phenomenal results. I was recently at the FACE conference in the UK, which is the largest aesthetic conference in Europe, and I was presenting some of my acne findings and the new techniques that I'm using, and it was really it was really amazing to see the audience, their engagement. They had never seen cases like this before, where we've had like the case that I showed of scarring, and they were really intrigued. And these physicians have come up to me afterwards and they've expressed an interest in coming to Trinidad to train with me, to learn my techniques. We have training every quarter at the Skin Health Institute, where I teach physicians from internationally. So I think that our before and afters are definitely incredible, and it's making a lot of traction internationally on a global scale, especially at these medical conferences.
Now, you mentioned, apart from eating healthy, you spoke about fish, veggies, coconuts, ground provision, and that sort of thing. And you also mentioned that a lot of women suffer from acne because of the that time of the month. But how do you live with acne? If it is that every month you're going to expect to get pimples, how do you prevent that?
So I think that when you treat acne correctly, you switch the gene off. So after 18 weeks, the disease is inactive, and that is healthy skin. If you go doing the wrong things, like let's just say you go putting coconut oil on your face and you go in the sun and you're not using sunscreen and you're eating the wrong foods and you're very stressed out, yes, the gene can become reactivated. But the key is to use the right topicals, a small regime, a correct regime every day that is specific to maintain acne, and you can be acne-free for the rest of your life. And strong skin is resilient. Strong skin, it doesn't matter if you go in the sun, if you are menstruating, if you're stressed, doesn't matter what you do. When skin is strong and healthy and working how it's supposed to, it will not break out because it's resilient to the environment.
That sounds fantastic. Acne-free living, that's amazing. How was it for you personally? I know you said that you did have acne. It was a struggle, but now psychologically you're more confident.
Absolutely. My patients come in, they look at me, they're like, Dr. Manna, you had such an incredible and such a quick transformation as well. So I feel so much more confident with respect to interacting, not just with my patients, but on a day-to-day basis with anyone in the entire public.
And you're a testimony, because I'm sure they look at your skin. First thing, they're going to look at your skin. So they're going to say, okay, well, I want my skin to look like that.
Sure. So that's our business card. So
Such a quick transformation as well.
You can't go for a hair transplant to a bald physician, right? Because then you're going to think he doesn't know what he's doing. So that is your business card. And what I love about our clinic is that everybody, we have about 20, 25 staff members, nobody wears foundation in the clinic. It's just our bare skin with our sunscreen, so that you can see that this is real.
Yes.
And the results that you see online look even better in person. And that's actually the most common compliment I get from patients, is that your skin looks so much better in person than it does online. And you said something to me yesterday, how different it feels now when patients come up to you and they say, Dr. Manna, I want skin like yours. And that's a beautiful testament to your work and your amazing results, especially on yourself.
Absolutely.
There's also this really other cool study that we were discussing last night that was published in 2011. And it's about how others perceive people with acne. So the study showed that basically what they did was they took patients and they gave the patient clear skin, and they gave the same patient acneic skin. And they took these images and they showed them to a group of observers. And they asked the observers to tell us what sort of emotions these images incite in you. Patients who have acne were deemed 49% more shy. They were deemed stressed, lonely, bored, and introverted. So the disease on your face gives a negative first impression, which is a field of evolutionary genetics. But when you took that same patient and you gave them clear skin, they were deemed 51% more intelligent, 51% more happy, more trustworthy, more healthy, and creative. So remember, we have a primitive mind. It's 2 million years old. And our mind is there to pick up on subtle cues like disease, that if somebody has diseased skin, it sends a negative first impression. So when you treat the skin, you get all of these other positive attributes for people who are engaging with you, which is very important as physicians who are treating skin, that our skin is really healthy and the best it can be, because not only does it give a positive first impression, but it also, speaks to the results of this sort of study.
Dr. Eckel, what sort of makeup would you recommend? Because some makeup clog your pores and it leads to blackheads, as you mentioned, and that can just escalate into a huge volcano on your face.
Excellent question. That's also part of lifestyle. So traditional makeup that we would purchase is full of things like dye, talc, oil, which we know acne is a disease of oil, alcohol, all of these irritating substances. And so what tends to happen is your 21-year-old has a bit of acne, so they buy the traditional makeup to cover up the acne, and then that makes the skin worse, and then they have to buy heavier makeup, and it's round and round and round and round we go, and it's this vicious cycle. And so instead of traditional makeup, you want to use pure, healthy, medical grade mineral makeup that basically is free of all of these preservatives. It just sits on the surface of the skin. It doesn't enter into skin. It doesn't clog pores. It doesn't cause disease. It gives you instant coverage, but also long-term benefits for your skin. Because you don't want to just put on something nice on your skin and you look good today, and then tomorrow you have 5 more pimples on your face because of the makeup that I used. Yeah. So mineral makeup is appropriate for acneic skin. It's also what we use because it promotes skin health. Another common culprit for acne in this climate, as we're talking about lifestyle, is hair care products. So a lot of our patients, use a lot of oils on their hair, okay, to control frizz, for example. And what happens is you put the oil on the hair, but then it transfers onto the forehead. And so you see this halo acne on the forehead and in that area, a very distinct demarcation. And it's because of the transfer of the oil from the scalp onto the face. So counseling them, advising them what are the right hair care products for their hair type. Oil, for example, or conditioner only goes from the ponytail down, because oil is basically meant to mimic our oil on our scalp. So we have enough up here, we need it down here where it's hard for our own sebum to reach. Yeah. So speaking to them about hair care. But interestingly, we also see a lot of other side effects from patients who are using the wrong scalp product. We see patients who get from this chronic use of these irritating hair care products on the skin. We're seeing this pigmentation that occurs on the lateral forehead, and it's this deep dermal pigmentation, meaning that you can't treat it. It's so deep that it gets interwoven between collagen fibers. Laser can't treat it, peels can't treat it, and it's just from this chronic use of this irritating topical agent on the hair.
Wow, we've learned a lot today. Thank you so much. What are your closing comments?
I think that acne is a very common condition that we see in this climate, and I think that it is something that can be easily remedied and give you back your confidence and just make you feel amazing and happy in your own skin.
Take back your confidence. Ladies, thank you so much. It's been a pleasure having you on. We look forward to many more conversations like these.
Thank you, Verna.
You're most welcome. We take a short break, a whole lot more when we return. Stay tuned.